Thank you for this invitation. I would like to start by saying that the pandemic continues to have a devastating impact on the people's well-being and the economic prosperity on a global scale, and this saddens us all. The lessons learned from the COVID-19 pandemic have shown that we need to be better prepared and have a proper response with mechanisms that go across the borders. This is a global pandemic and we need to find a fair and equitable global response. Now, universal and fair access to COVID-19 vaccines and treatments is a top priority for the European Union. The most urgent challenge is to ensure that there is a rapid and equitable rollout of vaccines and therapeutics worldwide. Global vaccine equity is both a moral imperative and a critical element of the control of the pandemic. The Commission has started to implement the EU strategy on COVID therapeutics together with the Member States. So we are increasing the likelihood that all who need treatment will have equitable and affordable access to the most appropriate treatment in the shortest possible time. The EU is also firmly committed to the global fight against COVID-19, supporting access to COVID-19 tools, accelerated and COVAX in its vaccine pillar. The EU and its member states, the financial institutions, all together as Team Europe, have mobilized 40 billion euros for partner countries' efforts to fight COVID-19. This includes a package of over 800 million euro for the ASEAN region. Amongst other activities, I would like to quote that we launched a project for South Asia health pandemic response and preparedness in partnership with WHO, which I thank. This project, I hope, will enhance the regional coordination of the COVID-19 response and will strengthen the capacity of health systems in South Asia in general, but it will pay special attention to vulnerable populations. And assistance for COVID to ASEAN countries ranges from support for health facilities and health workers, provisions of personnel and protective equipment, sanitizers, but also support for the economic recovery or technical assistance and institutional support. So as you can see, it's a broad range of actions. We have helped spearhead the global vaccine rollout with over 3 billion euros in support of COVAX to ensure the equitable access to COVID-19 vaccines to partner countries, including ASEAN countries. Team Europe is also committed to donating at least 200 million doses by the end of this year. We are every day working on this donation element. Moreover, the EU and ASEAN have agreed to exchange best practices, among policy practitioners and medical experts on vaccine authorization and production. So, what should be the upstream element. The EU has been a leading example in exporting, I would say, in the world. We have exported half of our production. We have never imposed any bans. We have been giving vaccines to the whole of the world. Since December 2020, the total is 630 million vaccine doses exported to over 55 countries in the world. Now, solidarity has also self-interest. We will never defeat the virus inside our own borders. Remember, this is a global pandemic. So this is not just about hitting targets, who comes first in the 70% race of vaccination. Now we are in a global race against the variants. So vaccination of all is the main weapon that we have to protect our own citizens and the citizens in the world. Now, vaccine solidarity is a geopolitical necessity, I hear from many of my colleagues, but I do believe that is the trademark of global cooperation. If we want to exit the pandemic, we need to help each other. We consider that this is the best way to bring a transformational impact that benefits all people, including the most vulnerable and marginalized. And especially, we should leave no one behind. In addition to exporting, we are investing and setting up vaccine manufacturing capacities in Africa. And we want to have increasing cooperation with the African Centers for Disease Control and Prevention. This cooperation should help them get much more capacity than they have today. Now, sharing in diagnostics, sharing in therapeutics is the other side of the coin, as I told you earlier on. So, testing in high-income countries is up to 100 times higher than in low-income countries. We must bridge this gap if we want to be credible. In our highly independent and interconnected world, international cooperation benefits every country, by benefiting the health security of each of us. Now, the level of health security globally is only as high as the weakest link. So coordination, solidarity need to secure adequate resources and exchange knowledge to protect us all. In this vein, the upcoming European Health Emergency Preparedness Response Authority, a very long explanation of the name HERA, hopefully will boost the international cooperation and the global emergency response. It's really my very fervent hope that it will happen so. We are ready to discuss any option that helps the end of the pandemic as soon as possible. Only a global approach with an immediate impact will help us out of the pandemic and make us better prepared for future cross-border threats. I would like to say also that we have to make sure that the World Health Organization can play its critical lead role to make the world safer against future pandemics. While reforms take time, that we all know, we have to use the current political momentum to move forward. I see a very important role for international law. Now, this could take the format of an international agreement that improves the preparedness and the response for future pandemics. But it can also help us all in having better regional and international cooperation to combat serious cross-border threats. The aim of such an international agreement, legally binding under international law, when I'm talking of an agreement is that I have in mind, is to forge a very high level of commitment towards a more robust global health architecture. Now, such an agreement would address gaps in existing regulatory framework, that is the important thing, promote international preparedness and response agreements, governance and oversight mechanisms, better national and regional preparedness and response mechanisms, stronger health systems, should also come with predictable funding, as well as technical assistance and capacity building, especially for low and lower middle income countries. We need to set in motion a dynamic and flexible progress of international cooperation among states and other stakeholders. This argues against only prioritizing an overall revision of the 2005 International Health Regulations, which is likely to require a protracted negotiating effort. So, within the G20, we focus on 3 priorities for the pandemic preparedness. Well, first, we want to strengthen resilience of our health systems. This requires continuous and increased investment in facilities, supplies, but also skills. We need to increase the capacity and flexibility of health systems to accommodate to a very changing demand and surges in demand. Secondly, and this must be clearly acknowledged, these reforms need targeted investment in health systems. Global solidarity and investments are at the core of our actions. We have therefore made, since 2014, a €2.6 billion contribution to international health programs, including to the WHO through the Universal Health Coverage Partnership Program. It's a lot of money. The third priority is to reinforce global health security architecture. I hope you understand what I mean. I mean that we may be building on our own HERA, but we need to have a possible international agreement to get to a better situation for the future. I would simply like to conclude by wishing you a fruitful discussion, to thank you for the possibility for me to address you, even though virtually and remotely. And I would like to say that your discussions will help clarify what global lessons we can learn from the pandemic and how we can build a future post-COVID in the preparedness field to deal with the challenges that will definitely come. Thank you very much.